If every primary care clinic had point-of-care ultrasound, I think this would transform the way we practice medicine. It would be cheaper, it would be more precise, also safer if you're using it especially for procedural guidance. So it would be a huge benefit. And I think patients would honestly be happier. Hi, I'm Dr. Tatiana Havryliuk. I'm an emergency physician and founder of Hello Sono. I've been using POCUS clinically for over 15 years in places ranging from busy New York City emergency departments to Everest Base Camp. I believe that POCUS has a huge role to play in the day-to-day of primary care clinician, from quickly diagnosing a DVT to evaluating for fluid overload in patients with CHF to even looking for an abscess. Instead of sending those patients out, you can do it at the bedside and really have a big impact on patient care. Nowadays, patients are expecting technology and data. So when you are using a tool like POCUS, they are getting to know what's going on clinically with them, and they are visualizing that, and that's an opportunity to also educate them. I have also found that there is a certain bond that you're developing with the patient when you spend just a few minutes longer at the bedside. The patients do appreciate getting more insight into their condition, and also they are more likely to follow through with the treatment if they are seeing, say, a pneumonia on ultrasound versus a normal lung. And if they see that pathology, they are more likely to be compliant. Ultrasound comes with limited ultrasound CPT codes, and as long as you are in a payer contracts that do direct billing, you bill for the ultrasound the way you would bill for any other procedure. So there is a potential, if you're performing 5 to 10 ultrasounds a week in your clinic, I'm talking POCUS, there's a potential of having a billable amount anywhere from $30,000 to $70,000 per year. Hello Sono partners with primary care clinics to support them in implementing point-of-care ultrasound in a safe and high-quality way, and also in a way that's financially sound. So we help throughout the whole process. We give comprehensive training, including the exam review, and support them through the credentialing process, as well as we help them with the implementation. So we help them design protocols for infection control, for credentialing. We help them come up with clinical pathways, and also figure out that billing component. How are you going to document? How are you going to bill? Exam review and feedback are essential to build confidence. For anyone who is learning point-of-care ultrasound and wants to meet credentialing standards that exist, we have board-certified emergency physicians and primary care physicians who have completed ultrasound fellowships, and they review the scans and give really actionable feedback so that learners can improve. Clarius devices are well suited for primary care because they are portable, they're affordable, they're user-friendly, and also there are some AI features that are really useful for primary care providers who are just starting with ultrasound. The portability and wireless design of Clarius devices makes it easy to move from room to room. If a primary care physician is considering introducing Clarius into their practice, I would fully support them. I think it's really a very good and useful tool to have in the primary care practice, and the learning curve is really easy and straightforward, and you will have the information at the bedside to make a clinical decision.